But I have a question here, doctor. As soon as you take the eye pill, will it lead to a bleeding tendency?
Well, it's very difficult to predict. It depends on when you're actually taking it. So if you're very close to your period, you might actually have a period immediately after that. Whereas if you're in mid-cycle, nothing might happen. You might just have a regular normal period, a period which is delayed by a few days, something of that sort.
Do they have to get a checkup after that?
Well, a woman can find out whether she's pregnant in a very simple method. It's quite as simple as taking this tablet, is by doing a urine pregnancy test. Now that is what each person does when they want to find out whether you're pregnant or not. Now the urine pregnancy test is a single-use disposable kit which is available in all pharmacies. So you go to a medical shop, ask for a pregnancy test, and you can get one of those. The instructions are very clearly given with each kit, and it uses a urine sample. It gives you a slightly more accurate result if you use a first morning sample, and that tells you whether you're actually pregnant or not. As long as the test shows negative, you can be very sure that the pregnancy is negative. If it turns out positive, that means when you get 2 lines on the kit, it tells you that you're pregnant.
Okay. Sometimes I heard people telling that there is a mild, second line has become very faint.
Yeah. Well, the most important thing is you just have to say whether there is 1 line or 2 lines. Whether it's faint or dark is something which is not very important.
Okay.
So if you see 2 lines, you know that you're pregnant. If you see 1 line, it's not pregnant. Whether it's a good pregnancy, it's a healthy pregnancy, or what stage the pregnancy is something which you should not decide based on your pregnancy test. It is just to tell you whether you're pregnant or not. And only a further evaluation by your doctor or by a scan can you actually predict how good the pregnancy is or how many pregnancies you have.
Doctor, you have talked about eye pill, and you said taking after 3 days of sex intercourse, the failure rate is more.
That's right. It's recommended only for up to 3 days.
Okay.
It's best.
By chance, if she found to be pregnant after that, after taking an eye pill, if she finds that she is pregnant, so how does it affect the baby?
Well, if you are pregnant and you have changed your mind about whether you want the pregnancy or not, well, if you want the pregnancy, it doesn't really make much of a difference, because the eye pill just contains a hormone called progesterone, which is something which your body also produces. So it will not affect the baby or maybe make your baby more abnormal than, say, if you had conceived normally. But if you don't want your pregnancy, then you actually need to think about all the options which are there. And there are many options if you don't want a pregnancy. The most important thing is you should be very sure about what you want. I mean, being not clear about whether your pregnancy is needed or unneeded is something which you need to decide. And it's best that you decide it along with your partner about what the needs are and how you would like to tackle it. If you do want to continue with the pregnancy, which is probably the best option because it's finally good news, is to see a doctor as early as possible so that he or she can actually start the proper care which a woman needs during her pregnancy and manage it appropriately. Whereas if you are sure that the circumstances are such that you cannot continue with the pregnancy, there are methods which could be either medical, that means you can have tablets, or surgical, where a procedure is performed under anesthesia to make sure that the pregnancy doesn't continue. And all this would depend on your medical background, any problems you have, and also the most important thing being how advanced the pregnancy is. It's much safer and more effective to go for a termination in which the pregnancy is quite early, whereas it becomes progressively more difficult if your pregnancy gets advanced.